The hardest discussions are often the most necessary, especially when it comes to preparing the end of your life. United Regional has a program designed for these scenarios and works with other community organizations to help make this process easier for everyone involved. Hearing the news that you have a potentially fatal disease is always a tough pill to swallow for not only the patient, but for their families as well. And making that transition from regular hospital care to something more serious requires a palliative care program, something Senior Director of Health Improvement Michelle Nelson says has blossomed at United Regional.
We kicked off palliative care in August of 2009. It was started out very small, and over the years we have grown it into a program that sees about 3,000 patients a year.
Michelle says many of these patients have been diagnosed with diabetes, heart failure, or cancer and have gone into more advanced stages of the diseases. It's at this point the patients need to know where to go from here.
A lot of times the patient and family are not prepared for that. So the palliative care program can step in and help navigate the patient understanding the disease prognosis.
And this is where an important document comes into play called an advance directive.
It's a document in the state of Texas that allows a patient to pick out a power of attorney, a medical power of attorney. The second layer is the directive to physicians. And this is the really important part as far as the palliative care is concerned. The directive to physician outlines specifically things the patient would or would not want in a critical acute care setting, whether it's life support, CPR, being intubated, tube feeding. So it allows the patient to think ahead and say, these are the things I'm okay with receiving, and these are the things I do not want to receive.
This palliative care program also works closely with the Hospice of Wichita Falls and the Transition Clinic.
You come to the point where you realize it's time for the hospice level of care. They do such an amazing job with symptom management. There's so much support for the family and the patient, and it just makes the quality of life so much better. The Transition Clinic is very much involved in advanced care planning process and palliative care process. Acute care settings, there's a lot of stress, a lot going on. So about a week after that patient is discharged, we make an appointment in the Transition Clinic. One of the providers over there will sit down with the patient and go over their understanding of their disease process and then help them navigate that advanced decision-making process.
And while this process can be overwhelming and somber at times, Michelle wants patients and their families to have a positive experience as much as possible.
Live for the now, understand what's important to you and your family, and make sure that's the focus of your life and not so much the doom and gloom of what's down the road.
Now, all the information about palliative care can be found in this Healthy You story over on TexAMOShomepage.com.